Hello, and welcome to this presentation of the new employee benefits in 2026 for grad assistants, fellows and scholars, postdocs, and certain short-term or part-time academic staff. Going forward, if you have questions about benefits, please see the HR website, hr.wisc.edu/benefits/grad, and email questions you might have to benefits@ohr.wisc.edu. You should also get to know who your local HR contacts will be within your own school, college, or division. Visit the HR website in the contact section and find a list of HR contacts whom you can reach out to locally. You'll find that your local HR office, the Office of Human Resources Benefits Unit, and in general, the Universities of Wisconsin website all have resources for you. All are important to learn more about your employment rules, org charts, leave usage, and insurance benefit options. Please take a moment to ensure that you understand who your contacts are and why you might reach out to them. An important resource we'll review again and again today is from Employee Trust Funds, whom we also call ETF. They publish a health benefits decision guide each year in which they compare and contrast this year's state-sponsored insurance options. You'll find this resource very useful. By the end of this benefit session today, you should better understand how to identify your enrollment deadline, how to review your plan options for the year, and how to send to us your insurance elections and waivers. The plans we'll discuss today will be health insurance, life insurance, and then other supplemental insurance plans such as dental and vision. The appointees who are eligible for benefits under this program are those who might be new graduate assistants, such as TAs and RAs, who are working a certain minimum FTE for at least a full semester, or new scholars, fellows, or postdocs, also known as employees in training, who are working a certain minimum FTE for usually at least a full semester, and then also new faculty, academic staff, and limited appointees who might be eligible for these quote unquote grad benefits instead of the Wisconsin retirement system. If you're not certain whether you're eligible for this benefit program, please reach out to your local human resource or payroll contact and they can assist you. Here's a special note if you are a faculty member, an academic staff employee, or a limited appointee, and you're not yet eligible for the Wisconsin retirement system, but you are eligible for these quote unquote grad or short-term employee benefits programs. Please see the next few hidden slides in the deck, which you can open via our website as a PDF, and review important information about how your benefits will change if your eligibility changes from being eligible for these grad benefits to becoming eligible for the Wisconsin retirement system. This is an important part of possible future employment for you, and we would like you to understand the requirements and get to know how quickly you might need to take action if changes are expected. As a new hire, you have 30 days from your start date to apply for or waive most of the state and UW insurance benefits. New employees are offered many different employee benefits, and before you choose to enroll in or waive any of the plans, we ask that you think carefully about what you need now and for the rest of this calendar year, but also what you might need in the future, because some of these programs are easy to elect or change during the year, while others may be offering you only this one chance for enrollment, and you may not be eligible to elect them if you don't do so now. Now, there are some of those plans that are very flexible when you want to enroll into or opt out of them or re-enroll in them, and they include the accidental death and dismemberment policy, the pre-tax parking program, and the optional retirement plans. Some plans, in fact, most of them, allow changes only at certain times of the year. For example, you're allowed to enroll into any of these plans on the screen: health insurance, accident insurance, dental insurance, vision insurance, and flexible spending accounts for those who are eligible, now within your initial 30 days as a new hire. You would also perhaps be eligible to enroll in them or make changes to already elected benefits within 30 days of a life event, like a marriage. Otherwise, to make changes to these benefits, whether you initially enrolled or waived them, you may need to wait for the annual enrollment period in the fall, and changes made during that time would be effective January 1st of the next year. And then it is our life insurance plan, the individual and family life, or I&F policy, that is offering you a new employee enrollment now as a new hire within your first 30 days. But if you do not enroll in the life insurance now, you may not be eligible to enroll it in the future. So do, when we talk about this plan, think carefully about whether you may need it now or even ever during your employment here at the UW. When your insurance coverage will begin depends on whether we receive your applications for enrollment timely, the start date of your employment, and then the type of insurance we're talking about at that moment. And as we work through the different insurance plans, we'll talk about when they would be effective, one by one. As I noted earlier, some of these plans could be affected in the middle of a year at some point if you incur a certain life event, like a marriage or the birth or adoption of a child, a divorce, a perhaps sometimes even an address change, and other reasons. So please review our website about qualifying life events and ask questions no more than 30 days after a life event has occurred to you. You usually have to take action before 30 days have passed if you from a life event in order to make changes to your benefits. And for those of you who might be international employees with families not yet with you in the US, or for employees who might in the future be turning 26 and who will then lose their parents' coverage, please take a look at the PDF version of these slides for some additional information immediately following this. Next up, we are talking about enrolling in your benefits, how you might submit your elections or opt-outs, waivers, how you confirm that everything went through smoothly, and then how you begin to pay for the insurance that you do elect. Your first step for benefits enrollments will be to set up your benefits account. This is a different interface than your Workday interface. So for this, you will set up and access a My Insurance Benefits account as a brand new hire. You can do this as soon as your second day of employment. How to set up your benefits account is listed here. You'll first create your My Wisconsin ID, then you'll log into the My Insurance Benefits portal. You'll select the plans and coverage that you want. You'll check any to-do items that remain outstanding on the system. And then finally, you'll review your benefits summary. You'll be doing this even if you plan to opt out or waive all of the insurance plans. So step one is to create your My Wisconsin ID. The first time you want to access your My Insurance benefits, you have to have already created this login. So have these things ready when you're starting the process. You'll want likely your smartphone because there's a free security app that you'll download to prove to the system that it really is you each time you log in. You want to be sure you have your full legal name and a personal email address. Ideally, do not use your @wisc.edu email address. Use something else. And then you'll want your other personal information, social security information, date of birth, address, etc. And then be ready to create a password that will be a combination of letters and numbers or symbols. For your first time access to this My Wisconsin ID setup, you may go to the ETF website listed on this screen, etf.wi.gov/my-benefits. And if you scroll down the page, there is a section about this first time access. You may find the video or the review on My Benefits Help to be useful. Again, more resources about setting up this My Wisconsin ID. It's such an important step. If you haven't yet set it up, you'll need to complete this one-time registration, and there is a knowledge base document, which we also call KBs here on campus, with more information. So when you get to the My Wisconsin website, you'll see a section either to sign in, but you can't do that yet if you don't already have your ID. So you'll look towards the bottom of that sign in section, and it will say, don't have an account? Sign up, and you'll click that hyperlink to begin. As you're submitting your initial setup, if you see a message, something like this, where it says something like, we are unable to verify your identity, or to complete the verification process, you must, then be sure to follow the instructions that are listed on the website. Um, for example, you may want to send them your name, your address, your employer as UW-Madison, and a statement that notes, please verify my benefits account. And then it can take them a few hours for the verification to be complete. Just be sure to follow up with them if you have questions. And now, once you do have your setup Wisconsin ID, you can log into your My Insurance Benefits. There is a tile in My UW that will link directly to that system. That may be convenient. There's also a direct website link if you want to save it in your favorites. There's also a link located in the Payroll and Benefits Hub in Workday under the suggested links. So you can reach this by any of these means. And once you're in My Benefits, you can expect to see a few things. There might be a pop-up noting how many days you have left for your enrollment, asking you to review personal information, maybe even noting some to-dos. If you click out of any pop-up, again, you'll see kind of the main page that will welcome you, and it will note again how many days you have left to elect your benefits. It'll note to-do items. It will even note any active benefits if you've already set some up. If you're beginning your enrollment, you can click on the Begin Enrollment button and then begin to walk through the different options available to you. As you're making your submissions, be sure to come back and check your to-do items. Examples of to-do items might be a dependent verification, where they're asking you to download a birth or a marriage certificate or adoption paperwork or the like. And if you are enrolling in any family plans, you do have to provide the following items: the full legal name of your family members, their sex, the relationship you have, whether it's your spouse or your child, etc., their dates of birth, and social security numbers. And then you'll need to follow up with this family enrollment with the official certificates of your relationships, whether it's a marriage certificate or a birth or adoption certificates. We do not need birth certificates for you, the employee. It's just for the family if you are choosing to cover them on your insurance. And after you complete your elections, you'll mark confirm or confirm changes if you've gone back in to make additional elections or changes. And then you can begin to view your active benefits. You may also print your benefits to open up an employee benefits summary report. This is a report that you could print or send as a PDF via email to yourself or to others who need proof of your current coverage. Now, if you cannot submit your choices online, talk to your local HR or payroll contact for assistance. Make sure to do this before your deadline is near, or reach out to my office, our benefit services office at benefits@ohr.wisc.edu if your local office can't assist you. Once your benefits are elected and active, you can begin to review them in Workday. To find your benefit elections in Workday, you'll be in Workday already. You'll go to the Personal section and to the Benefits and Pay section, and then there will be one of the drop-downs that is called Benefits Elections. And from there, you'll see an overview of the benefits that are up and active for you. One of the reasons you'll go into Workday to view your benefits is to ensure that the deductions that are coming out of your paychecks are coming and appropriate for you. The paychecks from the UW are issued biweekly every other Thursday, and talk to your local HR, payroll, or benefits coordinator if you have any questions about your paychecks themselves. What you can expect to see being deducted from your paychecks are the insurance premiums for any of the benefits that you've elected. If you are a 12-month calendar year employee, what you'll see for your monthly insurance premium deductions will be a monthly premium that is split between your first and your second paycheck every month, and they together will equal the full monthly premium that is paying for that very month's coverage. If instead you're a 9-month academic year employee, your monthly insurance premiums will be split between your first and your second check, September through May, to pay for each month's coverage. And you'll see additional deductions being withheld from those same checks to prepay for your upcoming June and July and August premiums. Because if you have an ongoing 9-month academic year appointment, we would expect you to continue to have the benefits over the summer, and then kind of things resume again once fall begins, September paychecks are available, and um, everything begins again for the year. Participants often have questions about who can be covered on their employee or scholar or fellowship plans. And so we have this little grid here for you. You, of course, as the participant, can enroll in any or all of these programs when eligible. If you have a legal spouse, you could also cover them on these programs. If you are not legally married, but you have a domestic partner, you could choose to cover the individual and family life for yourself and your partner, and the accidental death and dismemberment coverage for yourself and your partner. If you have children, they are eligible for your various insurance plans, and there aren't any of the plans that will extend to parents. All right, let's start with insurance details by talking about the health insurance, also called state group health. If you enroll timely in the state group health insurance, its effective date or start date for coverage will be the first of the month following your date of eligible hire. Or if your date of hire were the first of the month, your coverage will be retroeffective back to that first of the month once everything is processed through. There are 2 plan designs that you may elect as a grad assistant or other scholar, fellow, and individual eligible for this type of benefit programs. We have the health plan, which offers Wisconsin-based insurance and has a price that you would pay per month based on whether you want coverage as an individual or whether you want coverage for your entire family. And then there's the Access plan, which offers nationwide coverage and again has a monthly premium that you would pay depending upon whether you were an individual or you wanted to extend coverage to family members. This will be one of your first choices. It just is to decide whether you want one of the Wisconsin-based health plans that has a certain network you choose and you visit the doctors only in your network. If you go out of your network, there is no coverage unless it's an emergency situation. Or you choose the Access plan with its nationwide network. And they do have providers that they offer in network, and they prefer you to see those, but they allow you to go outside of the network and seek services. They will just be covered at less of a coverage level if you are outside of the network. So consider when you're choosing a health plan for the remainder of the year, what location you want your doctor to be in, what is convenient for you. Do you need to visit providers nationwide, or will you be all right just visiting providers locally? Think about the cost of the coverage. How much will you have withheld from your paychecks, also called your premium, just to be part of the plan? And then how much will you pay when it comes time to see the doctor or visit the hospital for services? And then also think about how the plan works. What is the cost when you're seeking preventive care versus if you're seeing diagnostic or urgent care? There will be medical deductibles, pharmacy benefits, and ultimately out-of-pocket limits. If you choose the Wisconsin-based health plan design, you must further choose a network of providers to be your doctors for the year, and remember to visit only your chosen network providers unless there's an emergency situation. Now, here in Dane County, where the UW-Madison is located, there are 3 networks that offer Dane County area providers. There's the Dean Health Plan, the Group Health Cooperative of South Central Wisconsin's Dane Choice Network, and the Quartz UW Health Network. The monthly premium we would pay would be the same regardless of which of the networks you choose. The difference is that who you see as your doctors will be different based on which of those networks you elect. It's very possible that you don't need a Dane County option though, and so I encourage you again to take a look at Employee Trust Fund's Health Plan Search webpage so that you are identifying the networks that are available for you and your family in the area where you would actually want to visit them. And a note, if you need coverage outside of Wisconsin. If you plan to seek medical care immediately outside of Wisconsin, in an immediately surrounding state, there may still be a Wisconsin-based health plan option that will offer you in-network options. Some of those Wisconsin-based plans stretch over the border into the surrounding states. So again, take a look at Employee Trust Fund's website and look for those Wisconsin plans that do have coverage in other states, if that is something that would be useful for you and your family. If you decide that the best option for yourself or your family is, in fact, the nationwide access plan, then the election, of course, is one that you can make, and you would have in-network providers with Dean in southern Wisconsin, but also with First Health across all of Wisconsin and nationwide. And then even if you go outside of the network and it's not an emergency, that's still allowed. You just won't have as much coverage for your services, which we'll talk about coming up. So as you are making your decisions about which program you want to elect for health insurance, consider visiting the websites, giving them a call, talking to the member services lines, finding out if you have a current doctor that you prefer, whether any of these networks include them. Think about where you live and where you work and where is it important for you to have clinics nearby? Is it more important to have them near your home, or is it more important to have them near where you are working? You can also ask about telemedicine services and about the hospitals that they would use if you needed surgeries. Any of that might help you narrow down your choices. We'll talk next about how much you will pay for preventive care, for office visits, as your annual deductible, and what out-of-pocket limits might be, depending upon whether you enroll in the health plan or the access plan. And you'll see that in general, they are identical unless we're talking about out of network, where the health plan in Wisconsin does not have coverage for out of network services unless it's an emergency. And the access plan, with its nationwide coverage, does allow out of network services just at a higher cost to you. So that's what's up next. Now, if you do enroll in one of the health plans, the coverage has become effective, and you are now visiting your network provider and receiving preventive care. Your preventive care is covered 100% per federal law. So that means at no cost to you, you would have your routine annual checkups, certain screenings for illnesses based on sex and age, certain well baby checkups, certain women's checkups, and certain prescriptions when you fill them at your network pharmacies, things like contraceptives, would be provided to you because of law at no cost to you. It's when your care is not preventive that you have to pay something for the care that you're receiving. So you will owe money of some sort for your covered visits and services and prescriptions, but there is an annual maximum to how much you must pay for those covered visits and services and prescriptions. And next up, we'll talk about how much you pay and when you might pay it, depending upon which of the deductible types of plans you elect. If you choose one of the Wisconsin-based health plans or the nationwide access plan, and you go in for your preventive care at an office visit, so you're seeing your general physician or you're taking your child to their pediatrician, you're visiting a nurse practitioner or your OB, then that preventive care is covered 100%. You pay nothing as an office visit charge. But it's when you're seeking care that is not preventive, that then you will have a cost to you to pay for those office visits. If you're visiting your primary care providers, including your mental health counselors, your chiropractor, you will pay $15 for the office visit copay. If you're visiting a specialist or going into an urgent care clinic or having a vision eye exam with your in-network ophthalmologist, then you pay a $25 office visit copay. And if you need to go to the emergency room, then you will pay a $75 copay, assuming you're not admitted to the hospital. So what this might look like is if I have a headache and I go to my general physician to talk about my headaches, and she counsels me and gives me ideas on how to relieve the pain, then I would leave that office visit having likely paid at the front desk $15 as my copay. She might charge $200 for the consultation, but I took care of my share when I paid my $15. Sometimes you need more than just an office visit. You need x-rays or diagnostic labs or surgical procedures. And in those cases, you must pay your annual deductible, your medical annual deductible off the top of that bill for the first time. That happens every year. So if in my previous example, I was talking to my doctor about my headaches and I paid my $15 to talk to her, but then she says, I'm worried about your head. Let's go down and get you a CT scan, or let's draw some blood to see about your allergies. Then that's no longer just an office consult. Now we're trotting on down to the x-ray area. Radiologists might need to view things, or I need to go to the lab and they might draw blood to be reviewed in the lab. That goes towards my medical annual deductible for the year. And the deductible is $250 per person per year. If you have a family plan, though, and multiple people in your family are all having x-rays or labs or surgeries, at most the family maximum is $500. So for those items that went towards your deductible, the remaining cost of them would be handled through coinsurance. So you pay your first $250 off the top of the bill, and then the rest of the bill for medical care would be covered 90% by the insurance company, and you pay 10%. Or if they're issuing you durable medical equipment, then you pay 20% of that cost, and the insurance company is paying 80% of the cost. If one person in your plan meets a $1,250 medical out-of-pocket limit, for the rest of that year, that person pays nothing more for their office visits, for their covered medical care, for the durable medical equipment, for those things that are covered and received in network, they are free to you, and the insurance pays 100%. So if I were to, again, go and have that CT scan, I paid my $15 to talk to my doctor, I then paid $250 towards the cost of the CT, and then I paid 10% of the rest of the bill. If after all of that and more, possibly, I've spent as much as $1,250, then I stop paying. And for the rest of my care for that year, the insurance company pays 100%. Or if this were family coverage and multiple people were having all of these multiple services, then at most $2,500 is what the family would pay for those covered medical items. That's known as the out-of-pocket limit. Also with the health plan and the access plan comes certain pharmacy benefits. You can search the Navitus formulary. Navitus is the company who runs the pharmacy benefits. And you'll find different prescriptions are put into different levels, and that's how you know how much you will pay for them. Some prescriptions will be considered preventive, and you'll pay nothing for them when you fill them at your in-network pharmacy. Other prescriptions may have a level 1 or a level 2 next to them. You would pay up to $5 per fill for level 1s. You'd pay 20% of the cost of a level 2, but never more than $50 at most. Or you might decide to go through the Costco mail order pharmacy if you have regular level 1 and level 2s that you fill and get 90 days of those drugs mailed to you for the cost of just 60 days. So 3 fills for the cost of 2. There might also be level 3 drugs that you need filled, and depending upon whether you have a letter of medical necessity from your doctor, there would be different costs for those level 3s. And then level 4 drugs might be specialty drugs that you fill at the UW specialty pharmacy or through Lumicera, and you pay $50 per fill for those. There are out-of-pocket limits for your pharmacy benefits as well. So under the health plan and the access plan, depending upon which prescription levels you've been filling, you wouldn't pay more than $600 per person for levels 1 and 2 over the course of a year, and not more than $10,600 per person for levels 3 and 4. You'll need to visit in-network pharmacies to use your Navitus state prescription coverage, and you'll be able to search for those out on the benefitplans.navitus.com website. Here's a quick overview of what the in-network coverage looks like under these traditional low deductible plans. Towards the top there, you see that there are prescription drugs that have certain copays or coinsurance amounts, And if you fill so many that you reach the out-of-pocket limit for a prescription tier, then the insurance company pays 100% of additional prescriptions in that tier through the rest of the calendar year. On the lower portion of the slide, you see that there are office visit copays. There's the medical deductible that you need to meet for certain items like labs, hospital services, durable medical equipment. And if you need to meet the deductible, then there's coinsurance after that. And if you ultimately, between all of that, meet the medical out-of-pocket limit of $1,250, then for the rest of the calendar year, the insurance pays 100% of that person's covered care services. Now, our year resets every January 1st. So if you are beginning the health insurance mid to late 2026, you'll have just through December 31st on this particular plan, and then things reset and restart January 1st. Then we're going to have a special word here about what if you receive services outside of your elective network for the year. Remember that if you chose the Wisconsin-based health plan, you're meant to visit only in-network providers. You will not have coverage outside of your chosen network unless it was for emergency care or urgent care. Examples of emergency care would be situations where your life is in danger if you don't receive care in the next hour. Severe allergic reactions, severe asthma attacks, heart attacks and strokes, you need to seek emergency care, and that is allowed to be outside of your typical network. What is not usually considered an emergency are fevers without rashes, most dental pain, sore throats, common cold or flu symptoms, most headaches. Those are generally not considered an emergency. And then situations where you might seek care of an urgent care clinic outside of your network might be a broken bone or some minor cuts or sprains, minor burns. Now, if you are nearby to your in-network urgent care, you must go to that in-network urgent care. But if you are traveling and away from your in-network urgent care and you have a sprain or you have a drug reaction, then it is acceptable to go to that out-of-network urgent care clinic since you're too far away from your in-network and you need urgent care. Things that are a bit different if you have the access plan, because again, you're allowed to go outside of their chosen network if you want to, but your costs will be higher. You'll pay the first $500 per person of covered medical services that were received outside of the network. And then you pay 30% of the additional costs. The insurance company pays 70%. And your share might be as much as $2,000 per person per year. Then we're going to have a special word here about what if you receive services outside of your elective network for the year. Remember that if you chose the Wisconsin-based health plan, you're meant to visit only in-network providers. You will not have coverage outside of your chosen network unless it was for emergency care or urgent care. Examples of emergency care would be situations where your life is in danger if you don't receive care in the next hour. Severe allergic reactions, severe asthma attacks, heart attacks and strokes, you need to seek emergency care, and that is allowed to be outside of your typical network. What is not usually considered an emergency are fevers without rashes, most dental pain, sore throats, common cold or flu symptoms, most headaches. Those are generally not considered an emergency. And then situations where you might seek care of an urgent care clinic outside of your network might be a broken bone or some minor cuts or sprains, minor burns. Now, if you are nearby to your in-network urgent care, you must go to that in-network urgent care. But if you are traveling and away from your in-network urgent care and you have a sprain or you have a drug reaction, then it is acceptable to go to that out-of-network urgent care clinic since you're too far away from your in-network and you need urgent care. Things that are a bit different if you have the access plan, because again, you're allowed to go outside of their chosen network if you want to, but your costs will be higher. You'll pay the first $500 per person of covered medical services that were received outside of the network. And then you pay 30% of the additional costs. The insurance company pays 70%, and your share might be as much as $2,000 per person per year. Please learn more about what the state's health insurance covers, as well as what it excludes, which is what is not covered in the certificate of coverage available out on Employee Trust Fund's website. And for answers to your additional questions, the details of the plans, how to contact the different networks, visit Employee Trust Fund's website. They have, again, that search function. They have a place where you can find out how to contact the various health plans, and they have a lovely FAQ section. If you have questions about something, it's likely that somebody else has asked those questions as well, and ETF has answers on their website. And then if you are enrolling in health insurance, you will receive ID cards. You'll receive a card from your insurance network, as well as a second card from Navitus for the pharmacy coverage. And then if you'd also elected the preventive uniform dental, you'll receive a card from Delta Dental for that. ID cards may take about 4 weeks after the enrollment is processed to reach you at your home address. It's the insurance company who mails them directly to you. And just make sure that your workday, home, and mailing addresses are correct so that they know where to send your cards once they're ready to issue them. As a review, here are the monthly premium costs, so the amount that would be deducted from your paycheck, cut in half. The first half of the month's contribution would come out of your first check of the month. The rest of the month's contribution would come out of the second check of the month. And we have the health plan and then the access plan that you have available to you. After you complete your elections in My Insurance Benefits, you can print a copy of your benefit elections to show as proof of coverage in case other plans or doctor's offices want you to show that you have enrolled in the coverage, even if you don't have your new cards yet. Printing your benefit as a PDF report should provide that documentation for you. Here in this next section, we're talking about the life insurance policy available to you as a new hire. Life insurance is a policy that would pay a benefit or an amount of money to your beneficiary, which might be one person, multiple people, or even an entity like a charity of your choice, if you were to die while having coverage under this plan. The idea is that the beneficiaries can then use that money to continue on without you. They can continue to pay for the mortgage or the rent. They can continue to save and prepare for childcare, education expenses. It replaces essentially your lost household income. Or sometimes it just is important for you, perhaps personally, to leave money to a charity that you love. So you may consider electing employee life insurance as a new hire if someone in your life relies upon your earnings to help pay their important bills, or perhaps if someone has co-signed on a loan with you and upon your death, they would become responsible for those payments. You may also want it simply to cover the cost of your funeral. And you want to think about it here as an employee, knowing that you may elect it as a new hire through your employer, and it is a guaranteed issue, meaning that the insurance company can't deny your coverage if you elect it timely. It's not based on your health at the moment, it's based on your new employment and that you chose to elect it. You should complete a beneficiary designation form for any of the life insurance plans that you elect so that the insurance company knows who should receive money if you were to die while having this coverage. The one life insurance option you have available to you as a new hire in this grad program is called individual and family life insurance. You may enroll for yourself as a new hire, and if you have a spouse or a domestic partner or an eligible child, you may also elect to have coverage on their life as well. Now, the cost to you to come out of your paychecks will depend on your age for the coverage you're electing for yourself and how much coverage you choose, how much coverage you want for yourself, and then how much coverage you may or may not want on eligible family members. If in the future you are beyond your initial 30-day new hire window, and it's then that you wished you applied for individual and family life insurance, There is a way to attempt to apply for it, and it's called evidence of insurability. It's a process through which you share your medical information with the insurance company. They review it, and then you wait to hear if they're going to approve your application. But it will all depend on what they think of your medical information. The EIO enrollment is not guaranteed. They might deny your application. So do think carefully about enrolling in individual and family life timely within your first 30 days if you think you may need it. And then their individual and family life insurance, or INF plan, offers coverage to new employees. As an employee, you can elect as little as $5,000 or moving up in $5,000 increments up to $20,000 as a new hire with a guaranteed issue. If you have a spouse or a domestic partner, you can elect $5,000 or $10,000 on their life. And if you have eligible children, you can elect $2,500 or $5,000 on their life. You'll see an example of the price per month on the right-hand side of the screen if you were to enroll for yourself for the $20,000 election, the highest you can go. Again, it depends on your age as to what you would pay per month. There are also maximum coverage levels that are allowed through this program. And let me flip to the next slide here. So for the INF policy, if you enroll as a new employee, you can begin to increase the level of your coverage that you're enrolled in and are paying for during the fall open enrollment every year. So these step ups can be, year by year, you can increase, for example, another $20,000 until eventually, after many years, you have as much as $300,000 on your own life, as much as $150,000 on your spouse or partner, and as much as $25,000 on your child. These annual increases for individual and family coverage are not offered to you if you didn't already enroll as a new hire. And life insurance, if it's elected timely, will be effective the first day of the month following the entry date. So assuming you sign up for individual and family life, and within your first 30 days, you submit your application, then the coverage would be effective the first of that next month following receipt of that entry. Here we have information about the accidental death and dismemberment, or AD&D insurance, and the state's accident insurance. And though these programs both have accident in their titles, they are two different plans with two different providers, and you can choose to enroll in both or neither, or just choose one or the other. I'll start first with the Universities of Wisconsin's accidental death and dismemberment policy. We usually just call this AD&D for short. The AD&D policy allows you to elect coverage that would pay out to your beneficiaries in the event of your accidental death, or that might pay you yourself if you were dismembered in an accident and still lived. So the benefit could be as small of an election as $25,000, or increase in increments all the way up to $500,000. And what you would pay per month depends on which of those benefit amounts you've elected, and then whether you want the coverage just for yourself or whether you're going to extend it to your family. If you do elect family coverage, then the benefits for your covered dependents will be a percentage of your own benefit amount. And the types of coverages that are available with the AD&D policy are listed in part here. There is 24/7 accident protection. There's the optional dependent coverage, as we introduced. And then there's a certain schedule of the payout, depending upon whether someone passes away or there's a dismemberment and they yet live. So depending upon how bad the accident is, how grievous the injury it results in, there would be certain payouts provided. If you do enroll in the accidental death and dismemberment policy, you must file your own claims with Zurich. So if you do elect this coverage, remember that you have it, put the plan information in your important papers section, and don't hesitate to file claims quickly if you or your covered dependents were injured in an accident. There is also, with this program, free travel assistance and identity theft assistance programs. So you are welcome to use those as well if you're enrolling in the AD&D plan. And this AD&D coverage is effective the first of the month after 30 days of eligible employment. Next, we have our accident insurance with Securian. This plan is part of the state of Wisconsin's offerings, and so you are allowed to cover yourself or your legal spouse or you and your children or both you, your spouse, and your children. And the price you will pay per month depends on which of those elections you make. With this accident insurance, if you have an accident, you should make a claim, and then the plan will evaluate your claim and may pay you a set amount based on the injury that you or your covered family member incurred. There could be payouts for certain accidental concussions, dislocations, an x-ray that was needed because of an accidental injury, and there's even an accidental death and dismemberment payout if you were to die in an accident. It could be up to $100,000. Here's an example of how this accident insurance may work. Let's say you're enrolled in the coverage, and then once you're actually covered by the plan, you do fall off a ladder. You break your leg and your wrist. You have to be driven to the emergency room in an ambulance, and you end up staying at the hospital for 2 days before they release you to go back home. You then submit your paperwork and your claim to Securian. They review it and they determine that for various injuries and circumstances, they are able to pay you $3,300 for your situation. That money is paid directly to you, and then you can do with that money what you will. Maybe it helps you pay your medical bills, or maybe those were already taken care of by insurance. And so you can use the money to order in food or to pay, in the example on the screen, for your childcare or for a dog sitter. The money is given to you and you spend it as how is best for you. If you do incur an accident, you have to submit your own claims to Securian. So you'll want to reach out to them quickly following an accident so that you begin the paperwork process. And the accident insurance is effective the first day of the month following your date of eligible hire or on your date of hire, if your date of hire was the first itself. In this section, we'll talk about dental insurance. I've taken these screenshots from that Employee Trust Fund's decision guide that I introduced earlier today, and you may want to look it up as you follow along. So the first column here for the Delta dental insurance is called Uniform Dental. This is a preventive dental plan that can be attached to your health election. So if you are enrolling in the state's health insurance, you could also enroll in the Uniform Dental and pay another $4 a month or another $11 a month to have preventive dental for yourself or for your family members. If, however, you are going to waive or opt out of the health insurance plan and you still want preventive dental coverage, then there is the program called Preventive Dental Plan, and you can elect that, again, either for coverage for yourself or to extend to your eligible family members. And then there are the options for major dental. There are two, and you would choose one of them if you wanted some major dental coverage for crowns and bridges and the like. There is the Select plan, which is less expensive than the Select Plus plan, but the Select plan will offer less coverage than if you were electing and paying the higher price for the Select Plus plan. On the next slide, we can compare them. So here is a grid, again, from that benefits decision guide that ETF offers. We have a column that describes the coverage offered in those preventive plans, whether it's the uniform dental that you're enrolling in because you're also enrolling in health, or the preventive plan that you're electing because you're waiving or opting out of health, but you still want preventive dental. And then there are the Select and the Select Plus plans, where you could choose one or the other if you want major dental coverage. Now note that there's important information about who the network providers may be, depending upon which of these options you select. There is an annual deductible that you may need to meet before that program will cover your major dental services. And then there's an annual maximum that each will not pay more than per mouth per year. That's the maximum that this plan will contribute towards a covered mouth. Again, you'll note some information about kind of routine evaluations and cleanings, which are under the uniform dental and preventive plans, but not under the Select or Select Plus. There's also information about the major services like crowns and implants and oral surgery Those are not covered by the preventive plans, but are instead covered at a percentage by the Select or the Select Plus plans when you're visiting their network providers. And then some of these plans include orthodontic coverage. For the preventive uniform dental plans, they cover 50% of an ortho bill for your dependent children, up to $1,500 for that child's lifetime. The Select plan has no orthodontia coverage, and the Select Plus plan does offer, again, a 50% coverage for orthodontia up to $1,500 for that person's lifetime. But this particular coverage is not limited by age. This particular coverage could allow coverage for adult orthodontia if you yourself or your covered older child or spouse may want to participate with some orthodontia. The dental insurance program works only when you visit their in-network providers. So do visit the deltadentalwisconsin.com website and search for providers based on your area and the type of coverage that you've elected. Your dental insurance, if enrolled timely, will be effective the first day of the month following your date of hire. Or if your date of hire was on the first of the month, once submitted timely, your coverage will be retroactive back to that start date, the first of the month. Next up, we have vision insurance. The state's vision insurance is offered through a company called MetLife, and what you will pay if you're participating in the vision insurance depends on who in your family you're covering, whether it's coverage just for yourself as an individual, or whether you're also extending the coverage to your legal spouse, or to your eligible dependent children, or to the full family, spouse and children, as well as yourself. And here's an overview of what the MetLife Vision offers. They offer a well-eye vision exam every year for a $15 copay. They'll also have certain allowances for frames and standard corrective lenses if you're getting glasses. There is some coverage for certain lens enhancements. And if you want contact lenses instead of eyeglasses, there is an arrangement for a certain allowance of the fitting itself and then the purchase of lenses. They can be up to a $150 allowance for those purchases each year. Also, as part of the MetLife Vision Insurance comes some additional coverage. There's some diabetic eye care enhancement, there's some LASIK service discounts, and there's even some hearing exam resources that are available to you. When you're using your vision insurance, it's important to visit only in-network providers, and you can find them by going to the MetLife website and looking up your state of Wisconsin Superior Vision Network. The vision insurance is effective the first of the month following your date of eligible hire, or if your date of hire was indeed the first of the month, then your coverage would be retroactive back to that first day of your employment. Again, that's assuming that you've enrolled and we've received your elections within that 30-day window. In this section, we'll talk about retirement plan options. Most of UW employees are eligible to participate in these optional retirement plans, but there are a few appointees who will not be eligible. So just note that if you are a fellow, a scholar, a non-service graduate intern or trainee, and most postdoc fellows, scholars, and trainees will not be eligible to participate in these employee programs. There are two optional retirement programs for those who are eligible. There's the UW's 403B, also known as the Supplemental Retirement Plan, or SRP for short, and the state's 457B, which is also known as the Wisconsin Deferred Compensation Plan, or WDC, sometimes just known as Deferred Comp. There is a side-by-side comparison chart here. The amounts you can contribute are based in part on your age, and they change, or they may change from one year to the next. There is no minimum contribution that you must make to be part of these programs. Neither is there an employer match, and it's up to you to decide whether you want to contribute pre-tax or post-tax. There will be certain admin fees charged based on the record keeper and program that you choose, and you would work directly with those programs if you had questions about the money that is being contributed and how it's being invested. To enroll in one or both of these optional retirement plans, we note the steps here on the slide. So first, to enroll in the UW's 403B, You'll decide on either Fidelity or TIAA as your record keeper, as your provider. You may even elect both if you would like to participate with both providers. You'll set up an account on your chosen provider's website, and then you'll submit a salary reduction agreement through Workday to tell us at the UW that you've elected your program and that this is a certain amount of money that you want to start sending to them every paycheck. On the other hand, if you're enrolling in the state's 457B, they handle everything more directly on their website. So you'll want to find the current plan enrollment code, which they do change quarterly, and then you'll go on to the Wisconsin Deferred Compensation website or give them a call. Let them know that your employer is the UW system, and then follow their directions to set up your account and to designate how much you want to contribute per paycheck. Once you're participating in one of these optional retirement plans, you're welcome to make changes to the amounts you contribute by starting, stopping, increasing, decreasing, restarting when you'd like. To make changes to the 403B, you'll make those yourself in Workday, or to change your 457B, you'll log in to the Wisconsin Deferred Comp website and then use their resources to make your changes directly there. Now, you may be coming from another employer who had a retirement plan and you want to move the money out of that former employer's retirement plan somewhere else. Now, the UW's 403B and the state's 457B plans will accept roll-ins. The first action you'll want to take is to open one of these new accounts, and then you'll work with your old plan about their distribution, and you'll work with the new plan about receiving the money from one to the other. And in this section, we'll talk about pre-tax spending accounts. Most UW employees are eligible to participate in pre-tax spending accounts. However, certain appointees are not. For example, fellows, scholars, non-service grad interns and trainees, and most postdocs will not be eligible to participate in these employee plans. There are two types of flexible spending accounts available for those who are eligible. There's the Health FSA, through which you can run medical expenses, prescription expenses, and dental and vision expenses for yourself and your eligible family. And there's the Dependent Daycare account, through which you can run after-school care and daycare expenses for yourself, your qualified dependents, even an eligible spouse if it's adult daycare for which you're paying. The idea behind pre-tax flexible spending accounts is that you are allowed, by using them, to send money to from your paychecks into your account with the company Task. That's who runs our FSA accounts in 2026. And the money you send to that FSA is not part of the 2026 taxable income that you are reporting when you file taxes. So for example, on the screen, you see someone who does not have the FSA, and they have earned in their job $200, but before they ever received their paycheck, taxes were withheld for income taxes, and so they may have received just $150 on their paycheck, and they can spend that money, of course, on anything they would like. If, however, they had elected the Health FSA and that $200 that they had earned as an employee, they had elected to send that to the flexible spending account, then no income taxes would be withheld from that $200. It would also not come to them on their paycheck. Instead, that $200 would be sent to the flexible spending account, and it would be waiting for them there to be spent on qualifying 2026 expenses. There are risks to electing a pre-tax flexible spending account. The money that you're sending to your FSA has a deadline by which you must have incurred an expense and used the money. If you don't, you can forfeit the unspent money that had been sitting in your account. Usually, the plan year ends December 31st, 2026, if you were electing this for 2026. So even if you're being hired mid-year, this year's plan ends at the end of the calendar year, unless your employment ends earlier, in which case you generally have to incur health expenses no later than the last day of the month in which your employment has ended. And you can only use the money that's in the account, in the FSA, for certain qualified expenses. So when we say you must incur an expense, we mean that you have received the service on a certain date that was allowed for your account. So the examples on the screen share some ideas. Off the top of my head, if you have the account and it's active as of July 1st, then when you go to the doctor on July 2nd or July 15th, then that could be an eligible expense that you are incurring in that time period when your account was active. But you couldn't go back, if your account started July 1st, you couldn't go back and use it for things that had happened to you in June or in May or in January because you didn't have the account at that time. And then when we talk about eligible or qualifying expenses, we're noting that there are only certain ways you're supposed to access your FSA funds. Certain medical, dental, and vision related expenses, certain childcare bills if you're on the dependent daycare account. And so you'll want to learn more about what's considered an eligible expense because you are responsible for learning how to use your FSA. There are resources that Task offers about eligible expenses, but you want to be sure that if you're accessing money from your flexible spending account, that it is per the IRS an allowable, eligible, qualifying expense for the type of account that you have. And then while I warned about the possibility of forfeiting unused money, there is a certain way where for the health and the limited purpose FSAs, a certain amount of money from one year to the next that hadn't been used may be carried forward and still follow you in your ongoing employment at the UW. So the situation is this: if you have the health or the limited purpose FSA, at the end of the year, do you have a balance of $50 or more that you hadn't yet been able to use? If the answer is yes, then, and your balance does have $50 or more, or you've reelected to add more money into the FSA for the next calendar year, then yes, you will have a balance carry over up to the maximum allowed for that year. Right now, the maximums are above $600, but there is a point where if you have more than that you hadn't used, you would forfeit the extra. Now, on the other hand, if your balance at the end of the year is less than $50 and you do not re-elect to add new money to the account the following calendar year, then you will lose that remaining smaller balance. It will be forfeit. And this slide shows more detail about that limited rollover. Right now, the limit that one could allow to be rolled over from one year to the next is as much as $660. And there is no rollover for the dependent daycare FSA. That is an absolute use it or lose it account. Even if your employment continues from one year to the next, you do forfeit any unspent balance. If you have a health or a limited purpose FSA, then the entire amount of money that you pledged to contribute for the year is available to be used upfront. You'll be issued an FSA debit card, and you could begin to use it at your doctor's office, at the pharmacy, or to pay your eligible bills online. The amount that it will pay will be up to the full amount that you pledged for the year. It will be available to you. On the other hand, if you have the dependent daycare FSA, there is no actual starting balance to that account. So your account opens, there's no money in it though until you have a paycheck and the money is sent to the account, and then you can submit a claim to withdraw the money and reimburse yourself for an eligible childcare expense. There is no debit card associated with a dependent daycare FSA. There are very few allowances for mid-year changes with flexible spending accounts. Usually you cannot change your election. That could be allowed if you have a certain type of qualifying life event and you submit a change form within 30 days of that event. But you'll want to look at Task's website or ask questions of your HR or our benefit services office if you have questions about making mid-year changes. And a very important part about your flexible spending account is that you will need to substantiate your claims, which means that when you use your debit card or you submit a claim to be run through your flexible spending account so that you can access that pre-tax money, you have to be ready to provide documents to Task to prove that it was in fact an eligible expense. If you do not or cannot timely substantiate your claim, then your claim will be denied. And if you had already used your debit card to pay for something that then you can't substantiate, you have to repay the FSA directly. And if you don't, then in fact, they'll deduct the money from your paycheck. So pay attention to communications that you get from TASC asking you to substantiate your claims. That is a requirement to use this program. For more information about health flexible spending accounts, and indeed some health savings accounts that we haven't talked about yet, we will later with the health section, look up IRS publication 969. And for more information about dependent daycare accounts, look up IRS publication 503. Your flexible spending account effective date is the first of the month following your date of eligible hire, or if your date of hire was in fact the first, then it will be effective on your very date of hire. The UW also has certain parking and transit pre-tax accounts that we'd like to introduce you to. First, please learn more about the transportation office at the UW-Madison. They allow you to purchase Madison Metro bus passes. They also have information about emergency taxi vouchers. They have what they call the Commuter Solutions resource, where you can find how to bus or bike or walk from home to work and back again. And they also offer pre-tax parking deductions via payroll if you are an employee who purchases an annual base lot permit. That is perhaps the most convenient way to pay pre-tax for parking, assuming you do have an annual base lot permit. There are other parking and transit pre-tax accounts available with TASC. The transit account is for those who have to pay out of pocket for a ride share, or they take a train or a subway to work, a van pool, they take a bus that's not part of this Madison Metro setup. They can elect the transit account, contribute a certain amount per month, and then use that money that's in their account to pay for those transit services that are for the purpose of their job. There's also a parking flexible spending account here with TASC. The parking account is not necessary, perhaps, if you are already arranging to pay pre-tax parking for an annual base lot permit directly to the transportation office. But maybe you're not doing that. You are parking in some other parking garage, or you have a monthly parking pass. In those cases, if you'd like to, you can sign up for the pre-tax parking account, contribute a certain amount per month, and again, use that money to reimburse yourself for your parking expenses. For the pre-tax parking account with TASC, the money is available to spend when you deposit it, not before, and you may enroll or change or stop your participation at any time. For the transit pre-tax account with TASC, again, the money is available to spend only once you've deposited it, and you can enroll, change, or stop your participation in the transit account at any time. The parking and transit accounts also have a $50 minimum carryover, similar to what we had discussed with the health and the limited purpose FSAs. And for the parking and transit accounts, because they are eligible to be enrolled in at any time of year, you should just note that if you were to sign up for one, then it will be effective the first of the month after your application has been received. And that wraps us up. Next, we're ending with some key takeaways and the next steps. So you will want to review your copy of this PowerPoint presentation. Again, if you don't find a download of it on our website, you can send an email to us, thebenefits@ohr.wisc.edu, and just ask for a copy of the PowerPoint. And then make sure that you have set up your My Wisconsin ID, and then go into your My Insurance Benefits portal and make your decisions for your benefits on or before your 30th day from your start date under the Wisconsin retirement system. And then in the meantime, reach out to your local HR or reach out to us at the Benefit Services Office if you have questions. An important point I just want to note once again is that in the future, if you have a life event like a marriage or the birth of a child or the divorce or the death of a family member, even if you move from one area of the state to another, you may have options to make changes to your initially elected insurance plans. But each different life event can allow different types of changes, and each of the insurance plans has their own allowances for changes based on life events. So take a look at our website for more information, more detail, and speak up to your local HR and or to our office, the Benefit Services Office, if you are anticipating or have recently had a life event. You usually have only 30 days from the event itself to make a change if you want to. 31 days can be too late. So make sure to take action sooner than later if you have questions about making changes to your benefits because of life changes. And that is it for today's presentation. Thank you for hanging in there with us, and for additional questions, reach out to your local HR and to us, benefits@ohr.wisc.edu. We're happy to help you, and our website is available with many resources. We look forward to working with you and answering your questions, and hope you find this new hire enrollment onboarding process. We hope it's as smooth as it can be. Take care and have a great day.